Jungle.
This is exclusive interview on AD4 TV Radio. Hello and welcome. I am Tunde Hassan. Dedicating oneself to the disadvantaged, the vulnerable, the excluded, and those at the margin of life is such an endearing endeavor, but which many find difficult to do. It takes time, energy, resourcefulness, a huge amount of patience, and above all, commitment and character. This is more so in an area as sensitive as health. This is the tough of my guest on exclusive interview, Dr. Iko Joseph Ibanga. He is the Executive Director of Pro Health International, a medical outreach initiative helping to bring succor and critically needed medical help to those who ordinarily find it difficult to access such. I will engage him on a range of issues on medical philanthropy and the issue of delivering health care to the people. First, this background.
Adequate health care provision is a necessity in society. An effective health care system contributes significantly to a country's development since it's a healthy citizenry that runs the affairs of state and drives development through production of goods and services. Good health care is an important determinant of the general physical and mental health well-being of people around the world. Access to health care varies across countries, communities, and individuals influenced by social and economic conditions as well as health policies. Providing health care services means the timely use of health services to achieve the best possible health outcomes. However, many nations across the globe face shortcomings in this regard. To mitigate these gaps, alternatives are often deployed, among which is volunteer or humanitarian initiatives to reach out to the most disadvantaged and probably excluded in terms of access and availability of needed health care. Medical charity involves free or discounted health care service offered by hospitals, non-governmental organizations, and even individuals to the sick who cannot afford proper health care service. Such can be ailment-specific or more generalized, direct delivery of health care to the disadvantaged. It also takes the form of advocacies, targeted medical research. Health-related charity make up about 81,000 of the more than 1 million public charities, according to the National Center for Charitable Statistics. For some time now, medical charity by individuals, organizations, and NGOs has helped bridge the gap in health care delivery, especially in crisis-prone areas where the citizens can hardly afford hospital bills.
You're most welcome to the platform.
Thank you, sir.
You've been at this medical outreach for some time, but before we talk about your foray into this particular aspect of philanthropy, what's your general assessment of the kind of healthcare need that people desire, and how are we able to provide and deliver on such in the country?
Thank you for that question. First of all, they always say health is wealth. Everybody wants to be healthy. Everybody. No one wants to be sick. And most people do whatever they can do to stay healthy. So people in rural villages, you'll have doctors, you'll have chemists, you'll have midwives, you'll have all kinds of people trying to keep you healthy. In towns, you have the range of the professionals and the non-professionals giving you medication, giving you advice on the internet. You have and all of this sells because people want to be healthy. As a medical doctor, we believe there's a scientific approach to health, and we know that to provide health care to the people in any country, especially like Nigeria, you need to look at the three healthcare systems: the primary healthcare, the secondary healthcare, and the tertiary healthcare. Those are teaching hospitals. The primary healthcare you have thousands of primary healthcare centers all over the country. If those were working properly, the population will be much healthier. And so the breakdown in the primary healthcare system is a reflection of you have massive people trooping to the secondary healthcare system to try to access healthcare. Is competitive, becomes expensive. And people end up in teaching hospitals because they are referred there, because it's a last hope. And so unfortunately, the healthcare system has not reflected the needs of the people in terms of even manpower. Right now, the big issue in Nigeria is the exodus of healthcare professionals to Western countries who are literally waiting for them. You know, whether it's in Canada, whether it's in the US, whether it's in the Arab countries, you know, they're waiting for Nigerian trained healthcare professionals. The training in Nigeria is very good. Worldwide, Nigerian doctors do very well. But because of the economic downturns and other issues, there's been a massive exodus of Nigerian healthcare professionals out of the country. And it's almost like we're bleeding, we're hemorrhaging, because the numbers literally are increasing every day.
Of those going out. So with an already poor patient-to-doctor ratio, this has made it even more difficult. Because people need health, the vacuum has to be filled by non-professionals who, one, they make it less expensive, they're more convincing, they can advertise. So people go there. But they also introduce quackery into the whole exercise.
Absolutely. Because, I mean, you're an engineer, you go to school to be trained. I'm a doctor, I go to school to be trained. Whatever you are, but where did these people go to be trained? You know, so...
In terms of the regulatory environment, I mean, here we have massive deficit in terms of healthcare delivery in the country. We also have a situation where the doctors who could help and the infrastructure and facility, the doctors are taking flight, the infrastructure is kind of shrinking. Even at those three levels that you mentioned, the primary healthcare, there's huge gap.
Yes.
We're not doing anything about it.
Yes, and it's unfortunate. It's unfortunate because in terms of priorities, you know, it's like they say, you must put your money where your mouth is. So you know the priority of any country by what it budgets to different headings. You look at how much we're budgeting for healthcare compared to what other countries are budgeting, you realize that we haven't even started. So to talk about improving Nigerian healthcare system, the government itself must look for how to increase funding towards health, and hopefully increase funding in such a way that it's not again sipping out because of corruption. And again, let's be fair, government always says that government cannot do it by themselves, which is true. So an environment must be created where the private sector can be encouraged to spend on health. See?
Now, you have a situation, you have the government, you have the private sector, and you have those who are, how do I put it, they're charity-minded, so to speak. At these three ends, those who are in it for business, the private sector, and the government who have to do it in rendering public service, and those that carve and look at the gaps in between these two these composite pillars, who do it for as a help. This is where you come in.
Yes.
How has it been doing this for you?
Well, for the last 30 years, we've started an organization called Pro Health, which essentially has gone to 24 African countries and 32 of the 36 states in Nigeria. to provide free healthcare, free eye surgery, free general surgery, gynecological surgery, free treatment, free to the patients. But how we've done it is that we get someone to pay for it. We've had partnerships with the Tiwadan General Foundation, with Northeast Development Commission, with NDDC, Niger Delta Development Commission, and private individuals, Pieces Foundation, that's some churches, Pastor Tunde Bakari's church and foundation. So over the years, we've been able to get private people, good-minded organizations to fund these treatments. And I can say that the sobering reality is that most people just cannot afford out-of-pocket payment for health. So, for example, next week we're carrying out these massive operations in the Federal Capital Territory in 3 separate hospitals where we hope to do 300 surgeries. So we had to open up a phone line for people to call in. Within 1 or 2 days, it was overfilled because the needs. Right now, we have close to 100 plus women that need uterine fibroid surgery, myomectomies. Just that alone. And what's interesting is that all these women have done their scan, they've done the investigations, but they're slapped with a bill of between 300 to 600, 700,000. Who can afford that? And insurance doesn't cover it for a lot of people. So, and even the percentage of people that have insurance is so low. So people are walking around with known ailments, known surgical needs that they can't
do
pay
anything
for. They can't do anything about. And they're living with it. So it's a very sad situation. It's a very sad situation. So what we do as a philanthropic organization is truly a drop in the ocean. It's truly a drop in the ocean because
yes, I was actually coming to that, and
yeah.
you outreach to a few hundreds of people. There's a whole ocean of others that cannot be reached and who cannot even access any kind of medical care. In terms of safety nets, do we have this National Health Insurance Scheme as a health safety net? Is it working?
In principle, it should work. The theory is perfect. But what's the percentage of Nigerians who have health insurance? I mean, they're quoting figures between 4 to less than 10%. Less so it's like maybe 4 or 5%. So what happens to the other 95% that have to pay out of pocket? So we've got to do something that allows a greater number to be registered. And it's not rocket science. These things can be done. That you cannot have, instead of having 4%, you can have like 50, 60, 70%. No country, America, Europe, UK, there's no country that has 100% coverage. So we can, but definitely the percentage of people who need health insurance is so much, and we're just touching a very small percentage. So we need to rejig that so that more people can have health insurance. Because with health insurance, what happens is that you may not need it most of the time, but because you're putting money into a common purse, it will treat someone else that will need it. And properly run, insurance companies make money.
We'll take a short break here and continue our conversation with Dr. Ibanga, who is the Executive Director, Pro Health International, and it is a medical outreach initiative. We'll be right back.
AD4 TV Radio, we focus on education with emphasis on research and innovation, science and technology, women and girl-child education, children, health, youth and sports, socio-political and economic reforms, security, environment, entrepreneurship, and entertainment. We'll give you information at your fingertips. Learn on the go. Follow AD4 TV Radio on Facebook, Twitter, LinkedIn, Instagram, and YouTube. AD4 TV Radio, reliable and credible.
We love you, AD4 TV Radio.
We're back. Exclusive interview on AD4 TV Radio. I still have my guest in the studio, Dr. Joseph Iko Ibanga, Executive Director, Pro Health International. Thanks for being with us.
My pleasure.
Before we took that break, we were talking about health insurance. there have been insinuations or maybe speculations that, let me tie it to the legalese. There are allegations that medical practitioners are in some kind of cahoot to defraud the system through National Health Insurance Scheme. Is there any veracity to this kind of allegation? I mean, you are in the practice.
Yeah. But what I would say is that, in theory,
that are citing unwholesome practices using the platform of the National Health Insurance Scheme.
Well, first of all, if you look at the history of this scheme, many of the directors were sacked and accused of corruption, including the last one. So truly, there's a system in place that needs better accountability. That if you have better accountability, you won't have to be sacking the head every time. So I can say that there needs to be a better sense of accountability. And insurance works in countries. It works all over the world. There's no reason why it shouldn't work in Nigeria. It works in India. It works in other literally third world countries. It works in Ghana. So we've got to get it to work, because that's really one of the key hopes if this thing is going to change. Without insurance, as long as people are paying out of pocket, health will become a major issue. Because when you do need help, you're not going to have the money. You rush into an emergency, and the doctor will say, you have to pay a deposit. A woman is bleeding to death. Where are you going to get a deposit? But if you had health insurance, you'll be treated first, then we'll worry about the payment later. So having health insurance is critical. Nigeria needs to get that right if we're going to improve our healthcare system. Yes, any system that is not with improper checks and balances will be abused.
Looking at the dilemma of healthcare delivery in Nigeria, here we have the patient-doctor ratio expanding. The cost is quite, let me use your word, it's quite sobering, almost frustrating. And then you have the drift in terms of health spending is nosediving almost frequently. Then you have the facilities even to deliver good quality healthcare are also shrinking.
Yeah.
To top that up, there's a drain of trained professional personnel. Can we stop the drift? Can we? I mean, is there any hope to stop the drift in healthcare delivery in Nigeria?
Well, let me expand that question. Can we stop the drift in the whole country? There's a drift. Healthcare is a reflection of that drift. You know, when the priorities are wrong, important things will suffer. Education is suffering, health is suffering, security is suffering. You know, means of livelihood is suffering. Unemployment is high. You know, so there will definitely be an increase in crime. But so I don't think we can isolate health and just there's a big problem that you need to try and solve them all at the same time. If you solve all the other problems, health will become better, clearly. But apart from saying that, if you try to dissect the issues with healthcare and what it is, what I would say, how can we stop the drift? All hands must be on deck. The private sector, there must be a way that hospitals can be set up at lower cost to the doctors. There must be a way central bank will give loans to set up more hospitals.
Or even grants.
Or grants or something. There must be a way to encourage government to do more with healthcare. Repair the private healthcare system and, get insensitized, give money, give more incentive to the healthcare workers. Nurses are on strike. Doctors are on strike all the time. What is it? It's basically incentives. So government has to address that. I mean, if you are paid well in your country, what would we be doing in somebody else's country? So government has its role to play. The private sector has its role to play. And then that individuals that don't know what to do with money. This is healthcare. There are big churches that have invested in health. Redeemed Church, I know, for example. Others, so we should encourage those churches to invest in health. Build hospitals, build clinics, run them well.
It was like that in the past.
Yes.
Missionaries did
Definitely.
that. Faith-based organizations did that across the divide. Muslim and Islamic and Christian faith had those facilities.
Yeah.
All of those gone.
Well,
most of them gone.
Yeah,
actually.
government took it over and ran it down. I trained in a mission hospital. That's where I think I get this motivation from. Well run, the best. It was then in Bendel State, Eku Baptist Hospital. Well run place. Government now takes it over and runs it down. I think we should encourage faith-based groups to reinvest in the country in terms of healthcare and education. Some of the best schools in this country were mission schools, literally. Look at a lot of them. I went to a mission, Catholic mission school, well run. So there's a way that government can encourage that, because there are people that want to do things, but there's a resistance to that right now by government itself. I mean, you can't
government doesn't want
you can't solve the problem, and you're not encouraging people to help you solve the problem.
That's a paradox.
Yeah, that's a tragedy.
It's a tragedy.
Because you have a problem, you feel that you have a problem. I mean, in the midst of the doctor's drift, a minister will make a statement like, "We don't need this many doctors." I mean, that there's a disconnect. And you are saying that you're a medical doctor yourself. So those are the kind of things that doesn't make sense. So you have a problem and you're putting your head in the sand like an ostrich. So the healthcare problem in Nigeria must be, I think we've identified it. We must be true to ourselves in terms of trying to find realistic solutions. And so that, I mean, it's like if the disease doesn't kill you, the quack will kill you, Yeah.
Now, as we gradually end this conversation, I've always been bothered about one thing. Do we look at healthcare and its delivery in the context of business or social service delivery? Like, do we see health as a part of the general investment in human capital, or do we see it as something that we can extract money from? Because we see an expansion of, even if they are quacks, even if they are substandard, it's an expansion of establishment of private healthcare delivery facilities in the country, mainly to make money.
In the course of doing this 1 week outreach, I came across a hospital we're going to use. It's called Tulsi Chandra Eye Hospital, right here in the Federal Capital Territory. They have what they call a 60-40 principle. 40% of the patients are high fee paying patients. The other 60% are treated literally free. The money they make from the 40% is enough to treat the others free. Okay, so it's a foundation, so it's not profit driven, but what they make is enough to treat patients, 60% of the patients free, and enough to run the hospital.
Is it like robbing Peter to pay Paul?
Well, in a way, yes. And it works. So what I'm saying, that there are different models that can be used. Some people want very high class, specialist treatment. There are hospitals like that, and they can afford it. But there should be hospitals where it's low fee paying that many people can access.
And can also deliver good care.
And deliver good care. And that's where, like I said, the mission hospitals had a niche. Because most mission hospitals were affordable. And they had committed people working there. And you were treated well when you went there. But in a government hospital that you're not paying the staff, nurses are not being paid for X months, doctors, of course, they're going to take out the frustration on patients.
Which is actually happening almost on a daily
basis.
Well, moving forward, where do you see medical outreach, like the one you drive? Where do you see it headed?
As long as there's a need, we will continue to exist. And I don't see this need going away soon. And like I said, we've been around for 30 years. I wish I could say that it has gotten better. Healthcare has not gotten better. It has actually worsened. So here we are in a Federal Capital Territory doing a medical outreach. primarily on IDPs. So we're going to treat all the IDPs that need medical, but there was a space for other people. We opened it up. Within 2 days, hundreds of women called up, and all of them had their lab results, had done, a basic ultrasound. And the thing that stopped them from getting treatment was the cost of surgery. So I encourage my colleagues that as a Christian, we do what they call tithing. Tithe your time. So give 1 or 2 weeks of your time in a year to just help the poor. Do the free surgeries, and that's how Pro Health has been sustained for 30 years, that people willingly, voluntarily come as medical personnel. They pay their own way to come, and they come and help out for that 1 week. And all of them say the same thing. It's such a fulfilling experience. Because truly, most people became doctors and nurses because they were looking for how to fulfill a God-given desire to be helpful. So that's the opportunity we give to healthcare professionals. And the patients are eternally grateful. Some of them never believe it, that is real. But you get it for free, completely free. So I'm grateful to God that one has that opportunity and privilege to do this.
Well, thank you very much. We wish you the very best as you continue on this path through the journey in life. Thank you very much, Doctor.
Thank you.
We've been with Dr. Iko Joseph Ibanga, Executive Director, Pro Health International, Pro Health, or let me say, Medical Outreach Initiative. And it's been quite forthright, engaging with us on exclusive interview. Thanks for joining us.
Audio Jungle.